have this system called Medicare and Medicaid, which is on the path of bankrupting the United States. And we have an elderly population which is growing and which, let's face it, has not saved all this money for their health care. How do we fix this problem? Because I have seen the problems with the system with my mother. It's too easy, this fee-for-service, and nobody paying for anything. So how do you fix this now? Because there's an expectation that they just go to doctors and they take tests, and no one's asking what anything costs. But my mother didn't save enough money to pay for her health care because there was this program in place.
She thinks she did because she was paying those taxes.
Exactly. Yeah. So now how do we fix this really big mess that the government has created?
You have to use the KISS principle, keep it simple, stupid.
Yeah.
That's how it has to work. I mean,
my mother loved that phrase. It's funny that he said that.
They have about 1,000 pages plus for the healthcare reform, and it's too confusing, too cumbersome, and nobody understands it. And Senator Khan just said, well, I need 2 lawyers to read it anyway.
What do you do now? You have this
monstrosity. You have to start looking for another system. You have to change the system. And you have to align the incentives of doctors and consumers. That's one. You have to eliminate the hospital providing outpatient services. That will let the doctors do it. Let the free market take over. For this kind of products to be available to people. I mean, this product will cover 80% of your medical needs, and it's just for only $79. I mean, there's other doctors.
Okay, but as you get older, you know, you wind up getting into much more expensive problems, knee replacements and all that kind of stuff. So
that has to be covered with the other catastrophic
insurance,
which is much cheaper. Yeah, exactly. Which is much cheaper than.
Yes, I mean, you're gonna go for the big stuff. These are the things that you need to be covered by insurance. Not the small stuff. The small stuff usually either your employee can pay for it gladly, or you can pay for it. It's not a huge amount of money that will bankrupt you. The thing that will bankrupt you is the hospitalization, big hospital bills. They're running about $100,000, $200,000, $300,000. It's very routine to have hospital bills. It's preemie baby. We had
that's what's bankrupt.
Yeah, preemie baby. We had 1, 2 twin. They stayed in the hospital for 75 days each. And the bill, I would say about 8 years ago, $750,000. Yes.
How was the system before the government got involved? And I have gray hair and I have some recollection that there was a time in New York when doctors were allowed to make a profit without a gazillion regulations and without outrageous insurance for ridiculous lawsuits. And what they had here was clinics that, you know, clinics always have a connotation of poor service. That was absolutely not the case. And I don't know, doctors, you know about, the clinics that exist. And as is my understanding, that they existed with the best doctors and the best care. Places like New York, Eye, Ear, Nose.
Well, these are the hospital-based clinics.
But they were still cost-free, and the doctors came in on a voluntary basis because they profited.
Well,
they were able to make money
talking about
because
15
they
years
made
ago.
money.
Well, you're looking at a rollback of the government regulation, the ERISA law of 1974.
But there is, a little seed of recollection that we had a government that worked and that wasn't totally involved in everything, and it was free market. And there are solutions that may not be able to be solved in in one administration, but they certainly need to be put out there as possibilities, as things that worked in the past that could work in the future, maybe with some tips and talks.
Repeal the HMO Act.
You're talking about, at that time, medicine was simpler.
And that is part of why I said there wasn't the technology.
No, they didn't have that many drugs, they didn't have that many technology.
Medicine was simpler, but so was there was no bureaucracy.
But
we can still have complicated medical procedures without bureaucracy, without ridiculous.
Why should that be an excuse for government intervention?
Nobody has a right to
No, it's not an excuse. I'm not saying it's an excuse. What I'm saying is that in order to go to that system, I mean,
We
But,
have to
I mean,
repeal the
actually,
We
this
have
HMO
to
Act.
take that, we have to let the doctors be able to set up a practice, which is very difficult for them now.
That's true,
To
I
begin
agree
a
with you.
practice and to make profit.
Well, because of the tort reform, because of
And
the
that's
cost of
what I
running
agree.
business,
But-
it's huge.
In other words, people that, if you say, well, tort reform, and people poo-poo it and say, oh, that's not gonna do any good. Well, it will do good if you, and you have to give them something to go to. When this is gone, what do we do? Then we go back to, but never say backward, God forbid, it has to be progressive. So then we say we progress to a clinic-type situation where good doctors who have made profit and have practiced for a certain amount of years, as opposed to this Obama thing where they have to commit a certain amount of years when they're out of medical school.
Well,
and they do doctors are where they're guinea pigs. You know, I mean, it's,
I don't think we have to go to that in that direction, but
why
could
not?
be
What direction now?
direction. I can tell you. I mean, you know,
Isaiah, did
This
you
is-
want to offer
The
a
direction
question or a
includes
direction?
the-
Yes, did you get a question?
no.
The thing is getting
more-
back-
what I'm saying is
Give
that
us a free market question.
the
Yeah.
doctors can open their own free practices, and let the doctors not necessarily join HMOs or any Medicare, Medicaid. Let the people come to them, and then they compete on price and service.
Now,
That's what will
good
happen.
for doctor visits, but then what about major medical?
Well, that's going to be
where-
that's a catastrophic insurance. Catastrophic insurance.
So
That's what you
essentially,
mean.
we're saying the same thing, just the.
Yes.
No, catastrophic insurance much cheaper. Because
Much cheaper.
Much cheaper, yes. You can get one now for $150 a month instead of paying
I'm just thinking
$400.
of children.
A lot of us are going to go out. We want to debate to people. We want to talk to people. We want to present problems with Obama's healthcare plan. What do you feel are the problems with Obama's healthcare plan?
Well, it's going to bankrupt this country.
I'm not going into detail.
There's no question about it. It's gonna. I mean, they're trying to cut the cost. They keep talking about cutting the cost, but then they're trying to raise $1 trillion. I mean, it doesn't make sense, you know. So if you're cutting the cost, and they have a lot of utopian ideas that they will cut the cost by, by EMR, electronic medical records, by doing this, by doing that, pay for performance, not necessarily fee for service. But these are all utopian ideas. I don't think it's going to materialize. Yeah, I mean, EMR does not cut down the cost. Actually, they're going to find out that EMR, electronic medical records, it will increase their cost. The reason is that I can tell you now, I don't know if you're familiar with the EME codes, evaluation and management codes, is 999, 201, 202, 203. So the doctors are billing according to the level of service they do, and it has to be documented. So most of the doctors don't have electronic medical records, so they write by hand, and even though they write by hand, still 50% of the medical claims are upcoded, meaning that the service level, if it's this, they're billing at a higher level. Even without electronic medical records. Now, can you imagine if you have electronic medical records? Because it's so easy to make that documentation for higher level of service. It's just templates. You know, the diagnosis are template, the examination is template. So you just click and choose, and then just create that visit with all the codes available, so you can bill at the highest code, and they will pay for it because you're justifying it.